Welcome to ICU Primary Prepcast. Hi, my name is Swapnil, and I'm joined by our co-host, Dr. Mike Clifford. Welcome, Mike.
Thanks, Swapnil. Hello again.
This is your favorite question. Can you please outline the neural pathways for the pupillary, light, corneal, oculomotor, and gag reflexes? And in this question, the examiners did specify that anatomical course of the nerves is not required. So what's your recommendation how to answer this question?
Okay. So, the first thing I would say to the candidates out there is don't panic. And the next thing to tell you is why I'm a keen proponent of this particular question and pushed hard to have it brought into the syllabus. First of all, we all need to be able to do a brainstem test to diagnose brain death for the purposes of organ donation. That's a core ICU training skill. The other thing is every time you go to the bedside, you may not use a cardiac output monitor, but a nurse will tell you what the pupils are doing. And if those pupils are abnormal, you need to understand why that might be the case. So the understanding of these reflexes is really, it's core business. And it's not actually that difficult. And even this SAQ is set up to enable you to pass. It says outline the neural pathways for light, cornea, oculomotor, gag. So there's 4 reflexes. You know roughly if it's out of 20 marks, that's going to be 5 marks each. So 5 points, if you like, for each of those. And the money's in the brainstem, okay? These are brainstem reflexes. They're designed to identify brainstem functioning or dysfunction. So an understanding of what the stimulus is, where it goes to the brainstem, what happens in the brainstem, how it gets back, and what happens next, those are the 5 bits. And we've specifically said, don't tell us about the anatomical course because no one can remember those and you're not head and neck surgeons. We just want you to know what is the reflex. And this is no more difficult than a knee-jerk reflex. And, the reality is you might see 10 patients on a ward round. You might do knee jerks on 2 of them, but every one of those patients will have their pupils done as part of the examination. So this is important. And you'll often ask the nursing staff, what's the cough like or what are they bringing up? Okay, so this is really, I call it bread and butter medicine. So let's just go through each of them. We've got 4 nerves. We've got to get 5 marks for each. That's okay. So let's start with pupillary light reflex. We've got a stimuli, which is obviously light in your torch. The afferent nerve, or going off to the brainstem, is cranial nerve 2, the optic nerve. The central integrator or brainstem component is the pretectal nuclei or the superior colliculi, which have interneurons that connect to the Edinger-Westphal nuclei. And the Edinger-Westphal nuclei is a parasympathetic nuclei. So now the efferent, which is coming back to the pupil, if you like, is the Edinger-Westphal nuclei's preganglionic parasympathetic fibers, and they run in cranial nerve 3, the oculomotor nerve, to the ciliary ganglion. And because it's a parasympathetic part of the nervous system, the ganglion is away from the brainstem or the spinal cord and close to the organ that needs it. And that's the ciliary ganglion. And then after synapsing in the ciliary ganglion, you have postganglionic fibers that run via the ciliary nerve to the sphincter papillae muscle of both eyes. And then the result is bilateral pupillary constriction, okay? And that's your direct and consensual response. So 5 things: stimuli, afferent, integrator, efferent, result. Next, we do exactly the same thing for the corneal reflex. The stimuli is touch, detected by fibers on the cornea, which is the clear part of the eye over the iris. And classically, it's done with a bit of cotton wool, but the nicer way to do it is to just put a drop of saline in the eye. The afferent fiber to the brainstem will be via the ophthalmic division, which is V1 of the trigeminal nerve, cranial nerve 5. And you don't need to name everything. You just need to just name one part of it, okay? Then the central integrator part, the brainstem bit, is the sensory nuclei of cranial nerve 5 in the pons, with interneurons that connect bilaterally to the motor nuclei of the efferents. And the motor nuclei of the efferents are cranial nerves 3 and 7, okay? 3 to move the eyes up and in as part of the blink, and most importantly, cranial nerve 7, the facial nerve, to orbicularis oculi, and that causes blinking of the eyelids. So blinking and squeezing close of both eyelids also involves an internal rotation of both eyes. So you're testing 2 more cranial nerves there, all right? Next, the oculomotor reflex, another one that tests quite a lot of material in the brainstem. So your stimuli is your either head movement laterally. Once you've cleared the cervical spine, you move the head laterally and you watch what happens to the eyes. Or, more commonly, after checking to make sure the tympanic membrane's intact, you put cold water inside the ear. So your afferent sensory fibers, there's two components to this. There's fibers on the skin that are sensing skin sensation, if you like, and that's via the mandibular branch of the trigeminal nerve and also a little bit of the vagus nerve on the inferior part of the tympanic membrane. But most importantly, the vestibular or vestibulo-ocular component of cranial nerve 8, right? That's where your semicircular canals are. Now, cranial nerve 8 vestibular nuclei in the medulla inputs to the medial longitudinal fasciculus, and that goes bilaterally to the motor nuclei of the efferent oculomotor nerves in the midbrain of pons. So again, cranial nerves 3, 4, and 6, and these act on our extraocular muscles. And the result is that both eyes move. Okay, so if you turn the head, the eyes stay fixed looking at something in the distance, so the eyes move away from where you're moving the head, right? That's normal. Or you put cold water in the ear, the cold water will deviate towards the eyes will deviate towards the cold water, and the nystagmus will flick the eyes away. Next is the gag reflex. And again, 5 things, stimuli. It's going to be touch via sensory fibers in the pharynx and the posterior wall of the mouth when you sweep your tongue back sweep your stick on the back wall of the pharynx. Then the sensory fibers travel via the glossopharyngeal nerve, cranial nerve 9, and it synapses in the gustatory ganglion, and then ipsilateral via the nucleus tractus solitarius in the medulla, which is the sort of taste and sensory fiber in the medulla. The central integrator occurs with ipsilateral nucleus tractus solitarius connections to the nucleus ambiguus, which is the motor nuclei of the vagus nerve. And then you'll end up via efferent pathways bilaterally on cranial nerve 9 and 10 to the pharyngeal plexus that innervates the constrictor muscles of the pharynx, and also a little bit of cranial nerve 3 to the palatal muscles. So the whole thing is one of constriction and elevation of the palate to prepare you for vomiting to come out. The result is elevation of your palate and constriction of your phalangeal muscles, which is a gag. So 4 nerves, 5 components to each, 20 marks. They all have the same thing: stimuli, afferent pathway, some sort of brainstem central integrated pathway, which is what we're testing really, a efferent pathway, which is the motor component of the arc, and then a result. And if you can do that for all of your cranial nerves, you'll have this knocked. And in fact, we don't test all of the cranial nerves as part of the brainstem testing, but you should be able to describe for your examiners light, cornea, the oculomotor, gag, and cough reflexes.
Thanks, Mike. As you said, this is integral part of the clinical examination in day-to-day life. Without knowing these pathways, testing brain death is going to be not very useful. So it's a very apt question for primary exam. And I guess this definitely challenged a lot of candidates. Well-written question. Thanks for sharing the answer, because I think a lot of candidates struggled, especially the structure of the answer, how that structure to be prepared. That's the end of our today's primary snippet. We'll be back another snippet in week's time. Till then, goodbye. Have a nice time.
See you later, everybody. Good luck.